Hey, Dr. Carter.
Hey, how you doing?
Good, thank you. I'd like to ask you about vitamin C. We just did a video on the evidence behind vitamin C, and of course, Dr. Osborne did an amazing talk on vitamin C and the evidence and what's going on in New York hospitals. But I think it's important that we know vitamin C is effective. How do we take it? So let's start with that. How do you take vitamin C with your patients? What are the various protocols and methods?
Well, there are various forms. Of course, you can get vitamin C in pill form, as well as a powder form, as well as liposomal, and in IV versions. So several different formulations are available for vitamin C. You can also, of course, get them as gummies and lozenges as well. So a whole host of ways to avail yourself of getting this important nutrient into the body.
You know, some people, and even the Linus Pauling Institute says that ascorbate is all you need in pill form, but there's a lot of talk about liposomal. Can you explain what liposomal is and what you think the advantages of it are?
Well, so let's go back with the powder form. So I would say if you don't have access to the liposomal form of the vitamin C, definitely get the powder, because the body needs a tremendous amount of vitamin C, especially in times when there is an infectious process going on. Mm-hmm. So the body will just totally gobble up vitamin C, and one can do what's called a vitamin C flush. And that involves taking, let's say, 3 to 4 grams, and that's 3,000 or 4,000 milligrams of vitamin C, which is well above the RDA of 75 milligrams or 90 milligrams. So, but vitamin C is water soluble, so you really can't become toxic from taking too much vitamin C. But going back to that vitamin C flush, taking 3,000 to 4,000 milligrams, and then say every hour, do another 3 to 4,000 milligrams until you reach what's called bowel tolerance. And that bowel tolerance is actually when you have diarrhea and so forth, but that lets you know that the body is pretty much saturated with the vitamin C. And then you can take that dose, so let's say you got to 20 grams or 20,000 milligrams. And then you would take 3/4 of that dose, so that would be 15 grams or 15,000 milligrams, and divide that over the course of a 24-hour period, doing it every 4 hours or 6 hours, dependent, and so forth. So that will kind of keep the blood levels up to a reasonable amount to help fight off whatever is going on. Now, the benefit of the liposomal vitamin C is it's wrapped in a lipid emulsion, so to speak. So there are a lot of liposomal supplements out there in the market, and there are, in fact, liposomal drugs, because that allows it to get directly into the cells, and that's where we want it. And especially in this situation, the viruses are located inside the cells. So having a liposomal form that allows it to more efficiently penetrate into the cells will be of great benefit. So the liposomal form comes in capsules as well as a liquid. And really the efficacy of that is very, very close to getting an IV.
I see.
So,
yep. So obviously the cell membrane, it's the lipid bilayers. So, you have to penetrate through the fat to get things into the cell. So
absolutely.
That makes total sense. Now, you talked about the tolerance is really related to gut symptoms, for example, diarrhea. So will the liposomal potentially overcome that problem? And I think the intravenous will definitely, but then if you go intravenous, will there be other symptoms other than gut dysbiosis from very high levels?
Well, and that's the beauty of taking the liposomal form or IV form. You don't get any bowel symptoms at all. Because again, this is going directly into the cells. The difference with the powder form is you will get to a level where there is the bowel intolerance just from the sheer volume. And at the end of the day, the absorption of that is quite a bit of a fraction of what you would get through an IV or in the liposomal form. So in terms of maybe 10 to 20% absorption of that full dose, that's what you would get in the oral form versus literally 100% absorption with the liposomal or IV form, which is, where we want to be. But unfortunately, everyone cannot go and get an IV due to, one, locations that are offering it, and two, it is a bit costly. This is not something that's generally covered by insurance, so it might cost $100 or $150 for the treatment, but it is an amazing way to deliver vitamin C, and it's been done like that for many, many years. So the liposomal form is definitely the next best thing to IV.
Okay.
And that has become very, very popular, especially in the functional medicine realms. And a lot of the companies that make it have been back ordered, even for the traditional, just powder form or pill form or lozenge form of vitamin C, showing that, a number of health professionals and their patients know about the benefits of vitamin C.
So traditional doctors, not just functional doctors, are doing intravenous vitamin C. Is that correct?
Yes, absolutely.
Mm-hmm. And what kind of dosing are they doing in the intravenous?
So the interesting thing, the doctor in China, one of the lead doctors out there, who is working with these patients, has been doing 10,000 to 20,000 milligrams of IV vitamin C, which they actually consider that high dose, but in the grand scheme of things, that's a moderately high dose, even though here in the US and abroad, much higher doses have been utilized for various other conditions. But for this conversation, he has noted that I believe it was about 358 patients that he utilized the IV vitamin C with that dosing range from 10,000 to 20,000 milligrams. And none of those patients died, which is obviously beautiful and something that we want to really look at as a part of the efficacy of that. So it definitely quells the cytokine storm.
Okay.
And
Very
helps
important.
to balance that so that things can be reversed.
Right. We're sort of indoctrinated to the right dose is one pill that we can easily swallow. Mm-hmm. And it doesn't always work out that way. Cod liver oil is a classic example, my favorite supplement, that you take one pill of fish oil and one pill of cod liver oil, which is fish oil on steroids with the fat-soluble vitamins, and we think that's the right dose, and we have RDAs. But if you really have a neurological condition, a brain condition, or even a cardiovascular condition, that's going to be an insufficient amount. And there were studies in Britain in the 19th century where they were giving between 15 and 50 grams of cod liver oil to people who were suffering from severe end-stage, late-stage tuberculosis, literally coughing blood. So that's between 15 to 50 capsules a day, and they were showing a significant reduction in overall mortality. So when you're healthy, one capsule just sort of, for maintenance is okay. But when your body's under stress, you have an extreme need. Like most of us, if we're eating good, healthy, nutritious fruits and vegetables, we're probably sufficient in vitamin C. But when we come under stress, we're probably not just doubling the need. We're probably quintupling or going up by order of magnitude 10 times the need requirement. Would you agree with that?
Absolutely. Even further than that. Because, at the end of the day, vitamin C is necessary as a part of our immune system.
Yeah.
So it is integral in the lymphocytes, which are a part of the white blood cell contingent of warriors out there going to fight viruses, bacteria, parasites, what have you. And that is one of the things that, we found early on when one is infected with coronavirus, that the lymphocyte level goes down. So now you want to have the vitamin C on board to build those lymphocytes back up, because it's telling you that the body is fighting something very serious, especially when they start going down. So having that vitamin C on board is going to be crucial.
Yeah, and Harvard Medical School in their workup of COVID-19 patients, one of the things they're looking for is a complete blood count with differential, but specifically looking for lymphopenia,
Yes.
Reduced lymphocyte levels. And so the vitamin C will support the production and the efficacy of those cells.
Absolutely.
Right.
And going back to the dosing for the liposomal, I tell my patients, and I use this myself and my family, we're taking as a baseline 2 grams of the liposomal variety on a daily basis. Now, if you were doing the powder or pills, I would probably do 4 to 6 grams, of that. But again, since there's more higher absorption, so let's say closer to 100% absorption of the liposomal variety, at baseline levels and you don't have any symptoms, 2 grams should be totally sufficient. Now, if one were to start getting a cough and fever and so forth, then you would want to up that both for the powder form as well as the liposomal form, and really kind of titrate that to symptoms. And again, if you have a fever, you want to be, a bit aggressive and note how your fever is progressing up or down over, a 24-hour period. And since, again, at the end of the day, there's really no toxicity to vitamin C, you can really be pretty aggressive with it.
And some of the liposomal vitamin C products are somewhat expensive, but compared to being sick, extraordinarily cheap. And of course, the pill form is one of the least expensive supplements out there. Vitamin D might be a little less expensive, but it's rather inexpensive. So
right. And of course, we want to make sure that we're adding, other things to that, not necessarily saying vitamin C is the end-all be-all. And again, we're still not saying this is a cure, but this can really help the symptoms and help push things at bay. But definitely wanting to make sure your vitamin D levels are appropriate, your vitamin A levels, zinc. Those are some of the baseline things that everyone really needs to be on, because it only just helps to boost your immune system.
Great, Dr. Carter. Great information. I really appreciate you taking the time to discuss vitamin C, how to take it, and really what it's doing. So, thanks again.